What are the problems of thyroid? They are broadly classified into two types, either functional or structural. The functional problems are either hyperthyroidism or hypothyroidism. Hyperthyroidism is a condition where there is excess production of thyroid hormone. Hypothyroidism is a condition where there is underproduction of thyroid hormone. The structural problems include goiter, which means there is swelling of the thyroid gland. Thyroid nodule, that means there is a specific single nodule in a part or a gland, or there can be multinodular goiter where there are multiple nodules in the same gland, or there can be thyroid carcinoma, which is a cancer of thyroid gland. Have you ever wondered what is the underlying cause of your thyroid problems? Autoimmune disease is one of the most common cause of your thyroid problems. It can either cause overproduction of the thyroid hormone or underproduction of the thyroid hormone. Iodine deficiency can also lead to your increased size of your thyroid gland called as goiter. Infections of thyroid gland can also cause pain in the thyroid with fever, which is commonly referred as thyroiditis. And most importantly, cancers of thyroid are pretty common these days. The cause of cancers can be genetic, certain kinds of medication, or exposure to radiation. Last but not least, certain kinds of elements like lithium can also cause thyroid problems. To conclude, the risk factors include age, which is generally seen in the older age groups. Females tend to have more thyroid problems compared to males. Autoimmune diseases can also cause thyroid problems, radiation exposure, and sometimes pregnancy can also trigger some thyroid problems in females. Do you know how to diagnose a thyroid problem? The structural problems can be very easily diagnosed with the help of an ultrasound, which is very cheap and reliable. MRI and CT scan can also be used in some kind of diseases like advanced thyroid cancers. The function of the gland can be known with the help of T3, T4 and TSH. T3 and T4 are nothing but the subcomponents of thyroid hormones. TSH is a thyroid stimulating hormone which comes from the brain and helps to assess its function. To confirm the findings of the CT and MRI or ultrasound, we do a test called FNAC, fine needle aspiration cytology, which tells us definitely what the lesion is. In some cases, we also do radionuclide study like I-131 scan, which helps in post-surgery of cancers to detect any residual diseases. Do you know the minerals that help you prevent getting any thyroid problems? We'll start with selenium. It's an important element in production of thyroid hormone, and it also acts as antioxidant. Zinc. It's a very important compound in converting the T3 to T4, which is the active ingredient of thyroid hormone. Iodine. As you all know, iodine is the most important element in the thyroid hormone, and the deficiency of it will definitely cause thyroid issue. B12. Vitamin B12 is not only important for your overall bodily functions, but also important for your thyroid gland. Magnesium is another important element for not only just thyroid issues, but also for your sleep and other bodily functions. If you are on thyroid medications already, make sure there is a 2-hour delay between your food intake and thyroid medication intake. Make sure you maintain correct dose and take it on time every day without forgetting. Do you want to prevent getting any thyroid problems? So follow my advice. Get enough iodine in your food, especially by consuming iodine salt provided by the government and other private players. Maintain a healthy lifestyle and decrease your stress. This is one of the most important cause of thyroid problems these days. Smoking. Avoid it as much as possible to get a better health, not just the thyroid problems, but also to avoid cancers. Get enough sleep, a minimum of 7 to 8 hours. A regular exercise of 30 minutes in a day can prevent you not only just the thyroid problems, but many other problems in your life. And do get regular checkups from your physician or ENT surgeon near you, so that we can diagnose your problem in early stages if at all there is a problem, and cure you of that disease. You want to know how thyroid affects you at pregnancy? If you have hypothyroidism, that is underproduction of thyroid hormone, it can affect the baby's development of its brain and nervous system. It also increases the risk of miscarriage, premature birth and low birth weight. If you have hyperthyroidism, there can be a risk of preeclampsia, which is characterized by high blood pressure and protein in your urine. It can result in premature births and also affects the baby's growth and development. So the tips to be followed are: make sure your thyroid hormone is in regular level before and during you attain pregnancy. Get regular doctor checkups and keep yourself educated regarding the problems of pregnancy due to thyroid problems. You want to know if your thyroid problem will be passed on to your child? Yes, some thyroid diseases are genetically linked, but they only affect a fraction of the diseases. Congenital hypothyroidism is a condition where the child has very less thyroid hormone production. The risk factors include genetic, low iodine, or certain kind of medications exposed by the mother during pregnancy. Hashimoto's thyroiditis is a type of autoimmune disease that can also affect children if the mother has hypothyroidism. If you have a thyroid problem and are planning to get pregnant, it is pivotal to meet your doctor and get your problems evaluated and treatment done so that you will have a problem-free pregnancy. Additional tips to follow during pregnancy: eat a healthy diet, get enough sleep, regular exercise, and manage stress. And also learn about your thyroid problems. Join a support group. You want to know how to manage your weight because of your thyroid problem? Most importantly, medical compliance. You have to take your medicines regularly. Have a balanced diet, which primarily includes portion control. That is, be mindful of your portion size and avoid overeating. Definitely a regular exercise would help in managing your weight, even though if you have a thyroid problem. Stress management. Chronic stress definitely affects your thyroid function. Adapt stress reducing techniques like yoga, deep breathing, and hobbies. Adequate sleep is the best stress buster. Track your calorie intake by monitoring them and by charting out your food intakes, and definitely stay hydrated. Stick to your medicines and closely regulate your thyroid functions by regular checkups and evaluation of thyroid functions. Join supportive help group or community where you can discuss your problems and get more insights like this. All these measures also help to reduce your stress, depression, and anxiety due to thyroid problems. Share and follow for more such content.